Guys, welcome to Clinical Unfiltered with Dr. Sasha. So give me your hearts, your minds, and your teeth and get unfiltered today with Dr. Pauline Lay, good friend of mine at Nova Southeastern University. You know, one of the things one of the main reasons I wanted to bring her on today is because when I saw her come out of dental school, she took off with this direction of using injections and injecting techniques to kind of grow her practice. Where the hell did that come from? How'd you get out of school and it's like, let's start shooting lips and that's going to be the way I grow my practice? How did that happen?
I wish I could say that I had like a direct...
Because I went to the same school as you, and like, I didn't get that feeling when I came out.
So how I landed in all this was I grew up doing nails. So my parents always owned nail salons and I grew up in the beauty industry. And when I got out of dental school, I was working Monday through Thursday. And this is the first time in my life that I've worked, or my working life, that I've worked 4 days a week. So that was very new to me. So I'm like, oh my gosh, what do I do with all this other time?
I feel like we're all having the opposite problem. We're like, oh my God, give me a break. That's funny. You're coming from the different angle. Gotcha.
Yeah, so I was like, okay, I still have opportunity to make money Friday, Saturday, Sunday. So I texted my friend, Anthea, who actually does permanent makeup. And I was like, hey, because I still had like my cosmetology license when I used to do nails. And I kept up with it because I was working still when I was in dental school on the weekends. And I was like, I wonder if I should go and take a permanent makeup course and build up a clientele and do this on the weekends. And then I just started searching up classes and taking like that. And then obviously Google, they know what you're looking up. And I started seeing things where dentists could inject. And there was still a very gray area where I was like, can we not? I'm not actually really sure. So I didn't know anybody that was doing it. And I was like, fuck it. I'm going to take the CE courses.
So you had no intention in dental school of like, this is something I'm going to implement. Okay, came out. Oh, wow. Okay, gotcha.
Yeah, I feel like everybody in dental school is like, oh, I want to do cosmetic dentistry. I'm going to do the all like small makeovers, but nobody even knows what that means when you're in dental school, right? Everyone thinks they want to do cosmetics and like, yeah. And then when I got out, that's when I was like, I'm just trying to make use of my time. I have 3 other days during the week that I can work. I'm used to working throughout the weekend. So I thought I was going to do permanent makeup. And then I found out that dentists can do injectables and facial aesthetics. And as I started learning more about it, I was like, oh my gosh, this is a solution for people like me. Like I clench and grind my teeth. And in dental school, all I learned was night guard, night guard, night guard. And through injectables, I learned that we can relax the muscles and retrain the muscles and tell it, hey, stop doing this. So personally, I wanted to be a patient myself. So I wanted to learn everything about it. And then I just drank the Kool-Aid and I went all in while I feel like when you first graduate dental school, you're like, oh, I'm going to take this CE course, that CE course. And nobody actually ever goes back and implements anything, right? They obviously learn more. They have all this knowledge in their brains, but they're actually not using it. So I just didn't get distracted. Once I chose this is the route I was going, this is the only CE courses I was taking. It's like I level 1, level 2, level 3. I started shadowing other injectors. I started learning from nurse practitioners. I started just going full in while my friends were like, oh, why are you not taking courses for implants? Why are you not taking more courses for endo? I'm like, I could, just like everybody else out there, but I want to be the master at my craft. Like, I don't want to be a jack of all trades. I want to be the best at this.
You leaned in on that. Were you an associate at the time when you were making this decision?
Yeah, so I was an associate.
Gotcha. Okay, so you hadn't opened up your own practice.
No, everybody looked at me like I was freaking crazy. My boss thought I was crazy. Everybody thought I was crazy. Everyone doubted me. My boss was so against it at the time, didn't want me to do it. So obviously I paid for my own courses and stuff, but I was like, well, I need to start implementing this. I'm talking to patients about it. Patients want it. And then I was like, well, I'm going to buy the product. I'm going to start doing this. I'm not giving this advice to other people because legality wise, I don't know how this is going to land you in your associateship. You might get fired.
But I actually think that's a very interesting point. But you wanted this so bad. You're in an associateship where she's like, nah, not going to help you out. You have to pay for your own CE. You bought the product and brought it into the office, into the associateship. See, I love this because I do a lot of 3D printing and I had the same hurdles too in the beginning. Everyone's like, why are you bringing this toy into an office? What's the actual use of it? And this is pre-surgical, this is early era of 3D printing. And so I bought my own printer I carried it around with me. And I mean, as it happened, people were like, oh, okay, this is cool. And then it became more popular. And then it was like a no shit Sherlock moment. But in the beginning, yeah, I had paid for my own dive into the whole concept of 3D printing. You paid and like drove your way into that own. Well, I feel like a lot of associates will come and be like, hey, pay for this, pay for this, pay for this. And I'm like, you don't own it. You don't own it. You don't own it. That's yours. That's like your craft. You brought in the product. You get to control what happens. And trust me, I'm sure you cared a lot more about what happens to that to that box of injectables than anyone else in that office.
And then so many people take it as barriers. Like, you have to have the vision for it. And if the people around you aren't supporting it, it's like, you can't just take that as like, oh, this isn't meant for me, or no, I'm not going to do it. It's like, take the risk yourself and prove it. Prove that this is something that is meant to be in the practice. And I think once my boss started seeing that people were scheduling, seeing like, this is his first time even dealing with injectables. So he didn't even know how to position it in the practice, right? So it's like, how do you pay an associate? How do you deal with the supplies? Because overhead on supplies is very different than dentistry. So it's not just like, oh, on production or collection when, Botox costs like half the cost already. So it's like trying to resolve all that. And maybe he just didn't have the capacity at the time to even like talk through all of that. So like by the time I'm already ready to roll this out to actual patients versus just like my family and friends, I already had solutions. I already had like all the codes, the cost structure, how much I'm going to pay for the product, how much I should be getting paid for the product, how much his cut was. Like, you have to present this to them like it's a win-win.
Right. Yeah. I mean, you came up with a business model for it.
So many associates are a little entitled with what their boss should pay for. And like, they just don't understand the behind the scenes business of it all. And I think the more you learn about it, the better you can position both sides. So
when was the transition to your own office? Because I do feel like, there was a moment. If you don't follow her on Instagram, what's your Instagram? Like,
just Dr. Pauline Lee, and then Lee Dental Spa.
There we go. Yeah. Follow it. And you can see how, you can kind of track her journey into like utilizing injectors and how it really did take off for her. And so when did that transition happen? You're in your associateship, you're starting to inject. Where in Florida are you at the time?
Jacksonville. So North Florida.
Okay. Interesting. Okay. Yeah. So then how did the transition happen where you started doing your own like Lips by Lee?
I just started scheduling. Like, people really enjoyed being a part of the journey. Just like you said, like, you can see my journey, and people enjoyed being a part of my CE courses. Like, oh, I'm flying here for this. I'm flying here to learn this. This is my new technique. I was posting my before and afters, and people were eating it up. Like, they wanted to be a part. It's like almost like they were rooting for me because they knew like the naysayers, people that are like, oh, this isn't going to work. Like, you're a dentist. Why are you doing this? And it's almost like everyone wanted it to work out, right? I built a lot of patients just from my social media, and people were coming in scheduling just for me for my injectables. Actually, at the time, I didn't even know how to position it like how I have it now. It was very like a la carte. It was like, oh, they wanted lips by me, or they wanted Botox in this area by me. But now I treat it just like dentistry. They're coming in with a chief concern, but I'm doing a comprehensive exam on their muscles, their volume loss, their skin quality. They're leaving with a full treatment plan, if not getting treatment that day, right? Just like with dentistry.
Started off, someone comes in, I want Botox. You give them Botox. Is that kind of how it like opened up or began? It wasn't like I see what you're doing now. Like, they come in, you evaluate, This is what we need. But in the beginning, you're saying it was more like whatever they demanded.
It was like, oh, I just want my 11s. Okay. It's like, okay, I'll do your 11s. I know how to treat that. I know how many units you need. Say less. Oh, I want lips. Okay. You're a candidate for lips. I know I can rock these lips. I'm doing your lips. But now I know how to look at the full face, facial balancing, just like with teeth, right? It's like, a beautiful set of veneers is so subjective, right? It's like, if you look at just the veneers itself, it could be very beautiful, but does it match the actual patient and the patient's face and the framework? And that's the same thing with facial aesthetics. You're not just treating the lips. You're not just treating a certain muscle. It's like, it has to match the patient and their lifestyle.
Out of all the self-branding techniques that you were doing at that time to like get the ball rolling, did you find any of them, like some of them more effective than others?
It was just Instagram. I built my whole practice off of just Instagram, because during that time when I quit my associateship, it was, let me just say, just make sure an attorney reads your contract before you sign anything for an associateship. Because mind you, when I started all of this, who I was working for were naysayers. They didn't believe in it. They didn't want anything to do with it. But as soon as I popped off, they wanted everything to do with it, right? And I abided by everything in that contract. The non-compete was 5 miles. I left 20 miles away. Like, I made sure like I was like leaving and like making sure I wasn't like stepping on anybody's toes, because I'm the type of person that I want to say I did everything clean and I still succeeded without stepping on anybody.
Man, this was a grind to get there. It wasn't you did have to grind. I probably put a chip on your shoulder in the process to like make this happen.
I thought I was just going to quit dentistry, honestly, because I was like, after all of this and then opening my own practice during all of that, because I wasn't allowed to have my own website. I would have won the case, but I was like, you know what? I want to like take my energy and use it towards actual other things versus trying to fight these people. So you know what? I can't have a website, say less. I'm going to go all in on my Instagram. And they try to shut down my Instagram and they couldn't. So there was a lot behind it. And we actually ended up agreeing that it's not like I was poaching patients, nothing of that. Like, I wasn't going to take any dental patients. I was going to agree, because most contracts is you can't see their patients for 2 years. So I was denying people left and right, So I just kept building and posting on social media, my cases, my before and afters, and just really resonating with natural, I think, results. The people who were chasing the natural results, they were like, oh my gosh, I didn't even know this patient got this, or I didn't know you could do it this way. I think most people think when they think Botox and fillers, it's that look, right? And just like dentistry, it's an art, right? Like, I have had so much done on my face, but I would hope that no one could point out and be like, oh, she's had that done, because it shouldn't just stick out.
Gotcha. Building nature. I mean, I feel like with cosmetic dentistry too, I feel like the best ones mimic nature. That's like the whole concept. So you do open up this office 20 miles away. You're still doing dentistry, right? Or you got like a separate LLC for doing the lips, or or the injections? Or are you doing it all in comprehensive in one practice?
So I found it best for my business positioning and the vision that we're going in is I kept everything under Lay Dental Spa LLC. But I treat my dentistry under a different provider and then my facial aesthetics under a different provider, because you want to be able to run your numbers and seeing where you're most successful and where your return on investment is, right? So I actually can see how the DMD side is doing and then the injectable side is doing. So then you can further plan, okay, so if I were to bring in an associate here versus if I were bringing in an injector here, what would it look like, right? And then what would the business look like if you were replacing just one of those positions, right? So I have it under the same LLC. We just have it scheduled under different providers. And then when you're running the reports, you're able to see it more clearly.
No, I mean, we harp on KPIs all the time. I feel like it would be easier to kind of track them in two different directions, especially from like a marketing standpoint and everything like that. In the beginning, do you feel like obviously you had a passion for this coming out. Were you like a 50-50 split, or were you like 80-20? Did you have like a rough number of how much of the facial aesthetics you were doing versus the general dentistry?
I'm still 75% facial aesthetics, but my practice is fee for service, right? So I didn't attract a lot of dental patients. I actually have most of my leads come in as facial aesthetics for injectables, and then they convert to dentistry. So it ends up being like a full circle. So most of my leads come in and we talk about like their sore TMJ or their sore muscles. And then I'm educating them about that. But then the conversation then leads to their occlusion, right? And then we do a scan in our office. So our exams aren't just, oh, I'm going to inject your masseters. It's let me actually figure out what else is going on. Even though you're not my dental patient, I'm going to scan you so you can have all the information about yourself so you can make the most informed decision for yourself. So most of the time it's malocclusion. So we can address that with Invisalign. I actually have other general dentists that refer to me to inject them. And then I help give them a treatment plan. It's like, hey, go back to your dentist. If they do Invisalign, I recommend this. If you've already gone through Invisalign, I actually recommend Viveras with anterior bite ramps to help with your symptoms. And then from there, they're already coming in every 3 months for their Botox. They're like, I just want to go ahead and get my teeth cleaned here. So then they turn into dental patients. And my patients, like, I really enjoy hanging out with them because these are the types of patients that want to do something about their issues, right? And so they're here for their cleaning, they're here for their Botox, they're here to actually resolve their issues regarding facial aesthetics that turn into dentistry. So they're here for all of it now.
It's funny. I feel like I always get or hear the like the notion that like patients who are getting injections and like those type of patients in quotations are like the ones you probably feel like would be the ones that would be annoying to treat. But you're right. They're patients who like care about themselves. They're proactive. They right. So it's probably easy to build value off, hey, let's look at like the metrics with, actual visible clinical data on them, like your iTero, your scans or whatever intraoral scans you're using and photos and radiographs and be like, oh, you got other problems too, by the way, and to convert them to do actual dentistry. So you said so you're doing an intraoral scan on the facial aesthetics patients as well. It's like part of their comprehensive exam. So you're sneaking in the dentistry of it in there as well. But I kind of get how it would be beneficial to know what type of aesthetic treatment they need, knowing that information. But that's awesome. That's like a nice little sneaky tactic, like Trojan horse it there.
I don't even think it's a tactic.
No. You got to understand, most of the people on this podcast will think like strategy. That's like, I mean, it might be so natural to consider that, but it's a good strategy.
I think I'm just so like strategic in my time. I want to work very efficiently. What ends up happening is if you're only treating people's chief concerns, let's even just relate this to dentistry. If this patient's only coming in for pain on this one tooth and you're just addressing the one tooth they keep bringing back, it's like, why didn't you just do the comprehensive exam from the beginning? Even if they're not going to treat everything right now, at least you have a game plan, right? So it's like most of the time patients are coming in for this one chief concern, but then they're trying to sneak in questions about this and sneak in questions about that. And it's like, you want me to answer, but I don't have all the data that I need. So let me get all the data so I can actually give you a actual plan for you to act on.
So patient comes in, and so these are lay dental spas. Patient comes in off, I'm assuming when they call and schedule, are they like, okay, we know this is a facial aesthetic patient and we know this is or are they all intermingled?
They're all intermingled. We do try to prime them on the phone what they're here for because my receptionist needs to know where to schedule them. But most of our leads are either going to be coming in for their dental visit, like comprehensive exam there, or either they're coming in for an Invisalign consult or they're coming in for a facial aesthetics consult. So we have 3 columns and I have my assistants do the consults with them. In those columns, and my team is ready to go for full circle. So if a patient's coming in for Invisalign, but they checked off and started, because in our medical history, we have facial aesthetics history and dental history part of it. So this then allows us to bring up other things in conversation. So if we see that they're overdue for their Botox, it was over 3 months ago, we bring up in their treatment plan or their data collection, because we take photos of their muscles and everything. And then we talk about our findings in that same visit. So my Invisalign assistant, she's ready to talk about Botox in that same consult. My facial aesthetics medical assistant, although the lead was coming in just for a facial aesthetics consult, she's ready to talk about your scan of your teeth and she's trained to scan your teeth. So if she hears trigger words like TMJ, jaw pain, just finished Invisalign, not wearing retainer, I have an old retainer that I lost, there's trigger words, right? That now my medical assistant trained to know, okay, I'm adding in this 3D scan code today and I'm scanning this patient today, right now, so I can actually be able to talk about all these other things with this patient. My dental patient who comes in for a comprehensive exam or let's say a limited exam, my dental assistant here is also ready to talk about muscles, volume loss, and skincare in that same consult.
Yeah, so they're all cross-trained. I mean, they could handle a consult in any of those columns. Have you like, all right, you're this column, like this is your focus dental assistant or medical assistant. You have them dedicated to a certain column?
Yeah, but they're all cross-trained, right? They are all able to fully do the consult from data collection. The only thing is my medical assistant doesn't take x-rays. So my dental assistant still has to do that part of it, but data collection, they can do it all. Treatment planning, they can do it all. Now, when it comes time to treatment, then the appropriate assistant for that department would then take over for treatment.
And those operatories are all like exactly the same? Do they look the same? Or is like, okay, the people who are coming in the facial aesthetic column, that's a different operatory. It's got a different vibe.
All my operatories are the same.
Okay, gotcha. So do they all lean more dental operatory standard, or is there like a hybrid? Did you modify them?
I'm lean, mean, and simple, plain Jane. I have a 12 o'clock cabinet, upper and lower. That's from IKEA. A white cabinet, black handles, and I got a sink and a mirror in my treatment rooms.
I love it. Okay, awesome. Okay, the sink. There's a mirror. There's a mirror. That's probably for the aesthetic to look. Okay, gotcha.
I don't know why dentists don't have mirrors in their treatment rooms. That is so bizarre to me. Like, let the patient bring something up to you. Like, God forbid, they're like, hey, doc, like, what's this? Like, they're not here just for cleaning. Like, let them look at themselves. Like, they probably want to ask you certain questions. It's just like, so many dental offices aren't trained to like be more curious.
Had to put a mirror in front of them and make them question themselves. Is that what you're saying?
Oh, after we data collect, that photo and that scan is on the TV.
Gotcha. Like straight up into their face again. Yeah, I mean we do a lot of the same stuff as far as like whatever data we get, whatever problem we get, it's going up. It's going up on one of the screens. So when this assistant kind of runs through all this, are they also like the way you have it set up? Are these the same people that are like talking about the treatment? Like when do you come into the picture in that examination?
Let me walk you through, I guess, my patient journey, and then that will kind of help, I guess, make all of this make sense. So marketing is bringing in leads, right? And then my setter, which is the receptionist, her job is to secure the leads, get them scheduled, make sure they don't cancel, making sure she's doing all her confirmations. And then from there, operations team is doing all the data collection. Now we're all cloud-based. So once they scan the teeth, once they take the photos, I have a series of photos that I take, my assistant takes for all of our patients. That helps me evaluate the muscles, the volume loss on their face, and then their skin quality, and then the photos of their teeth that then lets me do the clinical exam for dentistry, right? And then the x-rays. So I'm looking at all of this from my office. And then how we intercommunicate in our office is Slack. So through Slack, I'm able to communicate with my team. We start a thread for each patient, and I make notes, radiographic findings, blah, blah, blah. Clinical findings based off photos, blah, blah, blah. Clinical findings based off of scan, blah, blah, blah. And then muscle findings, volume loss findings, skincare findings. So these are all findings and diagnosis that we're communicating. While I'm sending all of that, the assistant is presenting that. All right. So while the assistant is presenting all of the findings,
okay, gotcha. So you're typing in these findings basing off all the data they're giving you, and they're seeing it through Slack while they're like chairside with the patient.
Scan, x-ray, and photos are going up on TV now. And then we follow a very like strategic SOP of what I want them to review with the patient before I'm even in there, right? And then from there, I'll go in and do my actual exam, right? Because I need to actually verify my findings. And then as I'm doing the exam, I don't even need to say anything out loud to the patient. I'll sit the patient up. I don't need to go over the spiel of findings again. Maybe there's certain things that I do need to bring up. I'll bring up to them. But other than that, this is now their opportunity to ask me any questions that didn't already get answered by my assistant. Oh, we also have a laminated sheet, and we call it a thought sheet. And we give the patient the power to write down any thoughts, any questions they're having during their entire visit. Because what I don't like during consults is that, like, the patients where, like, they ask a question about this, and as you're trying to answer it, they have another question about this. And it's like, okay, like, let me review everything. And then even after that, if you have any questions, we're going to go over it. Trust me. My thing at our practice is you are not going to leave with any unanswered questions. Okay. So they're writing all this on the thought sheet, right? If anything comes up. And I set them up. We're able to address that while I'm chopping it up with the patient. I've already slacked my assistant because we don't like to say a lot of verbal things to make the patient feel uncomfortable, because numbers, surfaces, the patient doesn't know what any of that means. Okay. So I'll just tell my assistant green light on the proposed treatment plan, or change this, and this. She's putting in the treatment plan as I'm chopping up with the patient. Patient doesn't have any questions. All right, understands the value. Now the next step is now my assistant is going to present the treatment. Presents, accepts, and then moves forward with treatment. And then obviously check up on them post-op, right?
When they're coming in for facial aesthetics, is there a lot of potential to like do same day treatment with a lot of their therapy?
Oh, it's same day. Yeah, we block it off enough time for that. So my recare patients for injectables is 30 minutes. And then new patients, we block off an hour to allow for that consult and the treatment itself.
Gotcha. Okay. So a lot of times those patients are anticipating same day treatment. Gotcha. Okay. So when I'm going to track back a little bit to when you actually like started this process of doing it in your own office. And obviously you've had a lot of time to hammer down the systems on how to make this the most efficient part of your office. The initial growing pains of doing this, were there any?
That's all there were. Still right? I've just gotten really good at resolving issues. I actually welcome them now because I'm always trying to optimize and refine. So growing pains is, I think, one, a lot of naysayers, and that's just going to be a lot of personal development that you have to get through. And then also growing pains in terms of setting up actual realistic expectations. I don't think enough practitioners spend enough time educating the patient on what they are to actually expect when it comes to injectables. They think it's like this magic wand. Patient comes in, wants this. Oh, I can do that. I'm going to do it. But realistically, this isn't a facelift. So educate them. I always say there are 3 options for you. There's going to be no treatment. You don't have to do anything. There's going to be restorative treatment that we are offering you today with injectables. And then there's going to be surgical options, just like with dentistry. Okay. So with surgical, if you're at that point in your treatment plan, I'm going to tell you that. And I give referrals, just like I refer to specialists, perio, endo. I refer to plastic surgeons. And I say, I can do threads, I can do filler, I can do all of this that will enhance where you're at, but I cannot give you the look of what a facelift will give you right now, right? And I don't think people spend enough time actually educating the patient and giving them an option that is outside of your practice, that is going to serve the patient better. Now, mind you, plastic surgery also isn't just a one and done. You have to maintain. Just like when you go to a periodontist and get an implant, you still need to maintain that implant, right? So people I think dentists who are trying to do this, they're thinking it's an a la carte thing when it's like, be true to yourself, your values, and treat this just like how you treat your comprehensive dental patients. So setting up expectations, actually giving them appropriate treatment plans in order for them to actually maintain this long term. This isn't just aesthetics. This is lifestyle, just like dentistry.
So if someone wanted to like bring in this concept into, because like I feel like there is the whole art of injection, and I do feel like we're going to do another episode on the actual injecting techniques and the actual clinical side of it. But as far as like building out a practice, is there any resources to like, hey, this is how you implement the CE that you've just obtained about injecting into your practice? Is there any connection there? Is there any like avenue or place to, resource for any of the doctors who would be listening who want to implement this?
So I had to figure a lot of this out on my own. Clinical CE courses, I trained with and for American Academy of Facial Aesthetics. I think they really focus on a lot of the anatomy, the injection techniques, like you said, the clinical side of things, right? What I was finding was a lot of people hit friction when they were trying to come back and implement it. So on the business side of things and the training your team, onboarding, getting people to buy into your vision, your assistant speaking the same language, especially when you're an associate, that's where a lot of people were hitting friction. It was like, I can't get anyone to do it. I don't, this is just a waste of money because they don't see that these are profitable margins. And then they just give up. So I had to figure out a lot of this on my own. And I actually have been documenting everything. And I haven't even told you, but I'm launching L'Academy the end of this quarter. So that's what I've actually been really passionate about.
Well, no, I mean, that's because I do feel like, I do hear a lot of hurdles about actually making this a bigger part of people's practices. Most of the people that I do know that aren't you that inject, it's like a very, they've got like one little cartridge of injectables in a corner of a fridge, and that's it. And they've got like a handful of patients. And I feel like that's not really bringing it into your practice per se. So I feel like there's a disconnect on how do you actually bring that concept and make it successful in a practice setting.
That's any CE course, right? It's like the doctors who go and they're on this high because they just got back from this Invisalign training and they're so ready to do all these cases that this clinical training said that they're going to do. And then they get back and their assistant doesn't even want to scan, or their receptionist doesn't even know how to answer the calls that the leads have questions about. How much does Invisalign cost? How long is this going to take? So I've mirrored all of that and helped answer all these questions. Not just me, every single one of my team members has helped me refine each of these SOPs in order for these clinicians to implement this into their practice. So I became really passionate about this because I was teaching clinically. And so many people were messaging me and DMing me after the course and asking me all these business questions. I would do so many Zoom calls, one-on-ones to help them. Then I was like, I need to just start documenting everything and then launching it as like an actual actionable course.
Right. And I also I feel like there have been solutions to that problem for like implants. There's courses on closing implant cases. They've figured out that that's a problem and created that and filled that gap. I haven't actually seen it for injectables yet. And so maybe that's what you're coming down the pipeline, which is great, guys. So guys, if you do want to, anyone listening wants to actually, take this on and implement it into your practice, Dr. Pauline Lay, your Instagram again is Dr. Pauline Lay or Lay Dental Spa, correct? To follow, and you'll probably see the pipeline of our courses that'll help you kind of actually implement these into your practice. It would be a great resource for you. And then we're going to come back on another episode and talk about actual injecting techniques and get some pearls from Dr. Pauline Lay. So thank you again, Dr. Pauline Lay, and thank you for getting unfiltered with us. Guys, we don't get paid. Sorry, Dr. Pauline Lay, you're not getting paid today for this. Click, like, comment, share, and thank you so much for listening.